Hi, everyone. Thanks for joining us today to go over the Medica Advantage 2026 plan updates. Before we begin, we do just want to say thank you for your continued trust, business, and your patience during this busy Medicare season. We do truly appreciate it. Before we dive into the 2026 plan information, we want to introduce the team behind Bauman Financial. Starting at the left side, we have Elaine, who is one of our Part D coordinators. So she's going to come in this time of year to help us run all the prescription reviews for those requesting reviews of your meds for the new year. Next to Elaine, we have Trish, who's really the reason or the face behind Bauman Financial. She's our founder, our owner. She's going to work on both the Medicare and the investment planning side. Next to Trish, we've got Ryan, who is also one of our investment professionals. So if you have financial questions, especially this time of year, we're probably going to direct you to talk with Ryan. Next to Ryan, we have Ashley, who is going to be another Medicare agent, individual health insurance. If you've called the office, you've probably spoke with her on the phone at some point. And then next to Ashley, we have Marsha, who is going to be our second Part B coordinator. So just like Elaine, she's going to come in this time of year to help run the prescription reviews, answer any medication questions you may have. All right, so diving into the content. So, like I said, we are going over the 2026 Medica Advantage plan updates. Medica Advantage is only going to be available in 4 counties currently in North Dakota. So they're going to be the blue counties that you see highlighted on the state map. So these counties are going to be Burleigh, Morton, Grand Forks, and Stutsman counties. If you live in one of the white counties, Medica is likely available to you. It's just going to be a different type of plan. So the content, benefits, premiums will all be slightly different. We are going to jump down here. They do have a large provider network. It's going to include health systems, including but not limited to Altru Health, CHI, St. Alexius, Essentia Health, Jamestown Regional Medical Center, Sanford Health, Trinity Health, as well as others. Medica Advantage does have 4 different plan types. On the far left side of the page, you can see it's going to break down all the different types of visits or different types of care you may receive. And then across the top, it's going to identify the 4 different plans. So starting on the left side, we've got the value plan. Next to the value plan, we have the select plan, also the preferred plan. And then on the far right side in the green, we have the H8889-009 plan. The 3 plans in blue, the value, select, and preferred, are all going to be medical and prescription plans. So they bundle your doctoring insurance as well as your prescription insurance. The plan that is in the green is going to be medical only, so it does not include your prescription insurance. If you are someone who needs the prescription insurance, we are going to steer you away from the green plan. These plans are designed for people who, maybe have benefits, prescription benefits at the VA, so they don't necessarily need the prescription insurance through Medicare. We are going to go back over to the left column. We're going to start with the value plan. This plan has a 0 monthly premium, so you're not paying anything per month to be on the plan. The annual out-of-pocket maximum, so worst case scenario, is going to be $6,750 per calendar year. It does not include a Part B premium reduction, which is going to be extra money back on your Social Security check, like we'll see on that medical only plan. Moving down the column, we're going to start with the medical benefits. So a primary care visit, you just go see your doctor at the clinic. It should cost you nothing out of pocket. It will be a $0 copay. Specialist visits are going to be $60 per visit. A specialist is going to be anything typically ending in ist: cardiologist, neurologist, physical therapist. Urgent care is going to be a $0 to $50 copay. So walk-in clinics might depend on why you're going in or the facility you're visiting. Mental health visits will be $50 copay per visit. Immunizations, screening, annual exams, the preventative care, $0 copay. Moving on to hospital care. So inpatient hospital stay, that's where anything where we're going to be admitted over a 24-hour period. Days 1 through 6 is going to be $450 per day. And then after day 6, it is 100% covered. An outpatient surgery is going to cost you anywhere between $445 to $475 on this plan. Typically, the range is also going to vary on where you're receiving care. If you are having the surgery done at an ambulatory surgical center, where that's kind of all they do is the same-day surgeries, it might be on the lower side of the scale versus having surgery done at like a true hospital might be on that higher side. Emergency room visits within the US are going to cost you $130 per visit. Worldwide, there is a 20% copay. So you'll pay 20% of whatever the overall cost of that visit would be. There is ambulance coverage for both ground and air ambulance. If you're transported by the ground ambulance, it is a $375 copay. If you are transported by air ambulance, it is a $475 copay. Diagnostic tests are going to be anywhere between $0 to $125 per test. X-rays will be $50 per scan. Diagnostic radiology, these are going to be things like MRIs, CT scans, maybe some ultrasounds. They're going to cost you anywhere between $0 to $250. Again, the range is going to be based on the type of scan you are receiving. Therapeutic radiology will be $85 copay. Diabetic supplies, so your glucose monitors and test strips, will be a $0 copay, but you can notice there's a little asterisk next to it. So if you look at the bottom of the page, kind of below the chart, it will say that the zero copay glucose monitors are limited to the Abbott Freestyle and the Roche AccuCheck received at a retail pharmacy. If you're getting another brand, you will likely have a copay. Skilled nursing care. So you can see it says no prior 3-day hospital stay required. So, maybe you are just needing to move into a skilled nursing facility temporarily for some rehab, before returning home or to your place of residence. So days 1 through 20 is going to be $0 per day. Days 21 through 52 will be $218 per day. And then days 53 through 100 will be back down at $0 per day. Part B, as in boy drugs. So Part B drugs are going to be anything administered by a health professional. So let's say you're going to the doctor and they are administering a cortisone shot, a Prolia shot, maybe an infusion. It's going to cost you anywhere between 0 to 20% of the overall cost of that particular, injection, infusion, whatever it may be. The Medica ADVANTAGE plans also include some extra perks or benefits. So with the value plan, the annual dental allowance is going to be $500. And how this works is you will receive a essentially like a little prepaid debit card or Visa card in the mail from Medica. And you will be able to use that card at any licensed dentist within the US. You'll have your dental work done. They'll tell you your total. You swipe your Medica Visa card first. It will pull off up to the $500 for your visit. If there's anything remaining after that $500, you will have to pay with whatever method you choose. If your visit is less than $500, it will only pull off, the amount that is entered, but up to $500 for the year. Your routine vision exam will be covered at $0. This is going to be your routine annual, so once per year. And then it also does include an eyewear allowance, which is going to be $100 for the year. It'll work the same way as the dental allowance. So you're going to purchase, your contacts or glasses. Maybe you just need new lenses. You're not getting new frames. Same thing. You're going to swipe your Medica Visa card first, and then you will pay out of pocket beyond that amount. It also does include some hearing benefit. You can see next to the routine annual hearing exam and hearing aids. Again, there's a couple asterisks, so just look slightly lower to the bottom of the page. It does say it has to be through an Epic provider. Right now, there are no Epic providers in the Bismarck-Mandan area. The closest that we are aware of are going to be in Fargo, and I believe we were told there's also one in Devil's Lake. So you have to be at an Epic provider to have that zero copay for the routine annual exam and to receive the pricing for those hearing aids on that bottom line. So there is three different tiers or categories. So the lower end of the hearing aids would be $549 through an Epic provider. The middle range for those hearing aids, $799. And then the highest tier is going to be $1,299. You can also go online to Epic and order them there as well. That kind of covers the value plan. So next we are going to jump over to the select plan. The select plan is going to have a premium of $71 per month. It does have an annual out-of-pocket maximum of $4,200. Again, this one also does not include the Part B premium reduction. Jumping down to the medical benefits. You go see your primary care physician for an office visit, should cost you nothing out of pocket. A specialist visit, again, anything ending in ist, will be $50 per visit. Urgent care has a range of $0 to $45 per visit. Mental health visits are going to be $30 per visit. Your immunizations, screenings, and annual exam or that preventative care should also be a $0 copay. An inpatient hospital stay here with the select plan will be $425 per stay. Notice this is not per day like the value plan, but $425 per stay. Whether you're in for one night or 6 consecutive nights, that is considered one stay. You are readmitted after several days or a day of being home, that will be a new stay. Your outpatient surgery will have a range of $295 to $375. Your emergency room copay will be $130 in the US, and outside of the US, worldwide, it will be a 20% copay, so 20% of the overall cost of that visit. Ambulance coverage will be $375 copay for ground ambulance and a $475 copay for air ambulance. Diagnostic tests will cost anywhere between $0 to $90 per test. X-rays are going to be $25 per scan. Diagnostic radiology with the select plan has a range of $0 to $90 per scan. Therapeutic radiology is going to be $85. Same as the value plan, the glucose monitors and test strips for diabetic supplies, zero copay, as long as you are purchasing the Abbott Freestyle and Roche AccuCheck at a retail pharmacy. If you are buying other brands, expect a copay. Skilled nursing care with the Select plan, days 1 through 20 is $0 per day. Days 21 through 41 are going to be $218 per day. And days 42 through 100 are $0 per day. Part B, drugs, also administered by a health professional, same as the value plan, 0 to 20%. So you are responsible for up to 20% of the overall cost of that, whether it's an injection, infusion, whatever it is that's being administered by a health professional. There is also those extra perks with the Select plan. So the dental benefit, you are going to get $600 for the year towards any dental work. Again, it comes on that Visa card. Your routine vision annual exam should be covered at no cost to you. Your eyewear allowance with the Select plan will be $150 for the year. Hearing benefit is the same as the value plan with a routine exam covered at $0 to you at an Epic hearing provider. Again, none currently in the Bismarck-Mandan area. And the copays for those hearing aids, depending on the tier of hearing aid you get, lower end is going to be $549. Middle tier is going to be $799. And the higher tier is going to be $1,299. Looking at the preferred plan. So this is going to be our last Medica plan that includes the drug benefit or the prescription benefit, I should say. The monthly premium is $205 per month. The annual out-of-pocket maximum is going to be $3,300. No Part B premium reduction with this plan either. Jumping down to the medical benefits, your primary care doctor will also be $0 copay on this plan. Specialist visits will be $15 per visit. Urgent care is going to be $0 to $30 per visit. Mental health will be $10 per visit. Preventative care with this plan, again, immunizations, screening, annual exam, covered at no cost to the member. Hospital care, your inpatient hospital stay will be $95 per stay. So again, not per day, but with the preferred plan, it is per stay. So whether you're in one night, 3, 4, 5, whatever it is, consecutive nights, $95. Anytime we go home and are readmitted, that will be a new stay, so a new charge. Outpatient surgery with the preferred plan will cost anywhere between $50 to $75 per surgery. Emergency room visits on the preferred plan will cost you $95 per visit, and worldwide should cost you as the member nothing out of pocket. Ambulance coverage will be $0 copay for ground ambulance and $350 for air ambulance. Diagnostic tests will cost you anywhere between $0 to $95, and x-rays will be $0 to you as the member. Diagnostic radiology will have a range of $0 to $95 per scan, and therapeutic radiology will have a copay of $50. Diabetic supplies, so again, glucose monitors and test strips, again, zero copay, but you are limited to the Abbott Freestyle and Roche AccuCheck at your retail pharmacy. Skilled nursing care with this plan, days 1 through 20 are $0 per day, and days 21 through 37 are $218 per day, and days 38 and beyond through day 100 are $0 per day. Part B medications, Again, 0 to 20% of the overall cost. Again, Part B medications are going to be administered by a healthcare professional. Dental allowance with the preferred plan is going to be $800 for the year. Your routine annual vision exam, again, covered at no cost to you. Eyewear allowance with the preferred plan will be $200 for the year. Same as the other two plans. You swipe your Visa card. Anything beyond the allotted amount for the year, you will be responsible for out of pocket. Hearing exam and hearing aids, again, through an Epic provider only. If you are at an Epic provider, the hearing exam, the routine hearing exam should be covered at no cost to you. And again, the different tiers for hearing aids, lower tier is going to be $549. Middle tier is going to be $799, and the higher tier will be $1,299. The last plan that Medica is going to offer in the 4 counties, like we mentioned at the beginning of this, is going to be that H8889-009 plan. Again, if you need the prescription insurance, this plan is not for you. This is designed for individuals such as veterans who get those pharmacy benefits at the VA. So it is a medical only plan. It does have a monthly premium of $0, so you're not paying anything per month to be on the plan. The annual out-of-pocket maximum is $6,750. So again, that's your worst case scenario for the year. And the Part B premium reduction is $100 a month. So what that is it's going to be an extra $100 back on your Social Security check each month. Your Medicare Part B does carry a premium. That's going to be on that red, white, and blue card that you have from the Social Security office when you first signed up for Medicare. That does carry a monthly premium. So that's getting deducted from your Social Security check automatically before you even receive your checks. So if you're on this medical only plan, you are getting $100 back per month on that Social Security check for that Part B premium that is withdrawn. Office visits on this plan will cost you nothing out of pocket. Specialist visits are going to be $50 per visit. Urgent care is $0 to $45 per visit, and mental health visits are $40. Your preventative care, so immunizations, screening, and annual exams are also going to be covered at no cost to you. And inpatient hospital stay is going to be $405 per day for days 1 through 6. So again, $405 per day for days 1 through 6. And then anything after day 6 will be 100% covered. Outpatient surgery will cost you anywhere from $325 to $375 per surgery. Emergency room care will be a $130 copay, and worldwide emergency room care will be a 20% copay. Ambulance coverage will be $395 copay, and air ambulance will be a $475 copay. Diagnostic tests will cost you anywhere between $0 to $90 per test, and x-rays will be at $25 per scan. Diagnostic radiology will be $0 to $90 per scan, and therapeutic radiology has a copay of $80. Diabetic supplies with the medical only plan are going to be the same as all the other 3 plans. $0 copay to you for monitors and for glucose monitors and test strips, but they are limited to the Abbott Freestyle or Roche AccuCheck at your retail pharmacy. Skilled nursing care, days 1 through 20 are also $0 per day with this plan, and days 21 through 52 are $218 per day. And then days 53 through 100 are back down to $0 per day. Part B drugs, again, administered by a health professional with this plan, also have that range of 0 to 20%. That's pretty standard across, most Medicare plans or Medicare Advantage plans, I should say. Your dental allowance with the medical only plan is $800 for the year. Your routine annual vision exam should be covered at no cost to you. The eyewear allowance will also be $100 for the year. Same as all the other plans, it's going to work on that Visa card. If you do forget your Visa card at home or forget you have it, you can pay out of pocket up front. Just make sure you're getting a copy of the itemized receipt and bringing it down to our office and request our help to fill out a reimbursement form. And we will get that sent into Medica and they can reimburse you that way as well. The hearing benefit with the medical only plan, again, is going to work the same way as all three other plans. $0 copay for the routine annual exam and the three different tiers for hearing aids as long as the services are done through an Epic provider. Jumping down to the next page, this is where we're going to talk about the prescription drug coverage. So with the value plan, again, that is going to be the $0 plan per month. That does include the drug coverage. The annual Part D deductible. You can see there is no deductible for tiers 1 and 2. It's a $0. But the deductible does apply towards tiers 3, 4, and 5, and that deductible is $615 for 2026. Insulin coverage at any network pharmacy for a 30-day supply of insulin will be $35. A 90-day supply will be $105, and it does not apply towards the deductible. Below that, you can see the tier 1 medications or your preferred generics will be a $0 copay to the member. Tier 2 or generic medications, $6 copay. Your tier 3 medications or preferred brand will be a 16% copay. Tier 4 or your non-preferred drugs, a 50% copay. And your tier 5 will be a specialty, considered a specialty drug, that is a 25% copay. So those pricings were for the 30-day retail. So if you're going to your local pharmacy and filling, that is what the cost is for you as the member. And it does have to be at an in-network pharmacy for all the pricing you see here. Just as all the pricing we saw on the previous page for the medical visits, those are prices for your in-network providers. If you just look below the 30-day retail, you will see the 90-day mail order. So that is going to be through Medica's mail order pharmacy, where they just mail you your medications on a 90-day basis. Your tier 1 or preferred generics, again, are going to have a $0 copay. Your tier 2 or generic medications, again, 90-day supply, it will cost you $18 for the fill. Your tier 3 or your preferred brand, also 16%. And your tier 4 or non-preferred drugs will be a 50% copay. Below that, you can see the catastrophic coverage. It says it does, the plan does pay cost exceeding $2,100. So for any medications that are covered with the plan's formulary, once the total cost has reached $2,100, you will be done paying on those medications for the year. You will enter what is known as the catastrophic coverage phase, and Medica will pay for the rest of your medications for the year. But again, they do have to be included on the formulary. So if you have any medications that are not covered with Medica's formulary, that accumulation for any meds not covered is going to be outside of the $2,100. The select plan, again, the $71 a month plan, also includes the drug coverage. Tiers 1 and 2 do not have a deductible. Tiers 3, 4, and 5 do have a deductible, and that is going to be $325. Insulin coverage, again, is going to be $35 copay for a 30-day supply and $105 for a 90-day supply. And there's no deductible for the insulin coverage. Your 30-day retail or local pharmacy costs, the tier 1 preferred generic is going to be $0 copay. Tier 2 generics are going to be an $8 copay. Your tier 3 preferred brand, 19%. Tier 4 non-preferred drugs, 50%. Tier 5 specialty drugs are 29%. Looking right below that to the 90-day mail order, Tier 1 preferred generics, also $0. Tier 2 generics, $24. Tier 3 preferred brand, 19%, and Tier 4 non-preferred drugs are 50%. Again, the catastrophic coverage does apply to all three plans that include the drug benefit. Last plan with the drug coverage, the preferred plan, or $205 per month. Tiers 1 and 2, also no deductible. Tiers 3, 4, and 5 do apply towards the deductible, and that is going to be $240. Insulin coverage for a 30-day supply will cost you $35, and a 90-day supply will cost you $105. Again, no deductible for insulin. Tier 1, your preferred generics, $0 copay. Tier 2, generics, $7 copay. Tier 3, your preferred brand, your responsibility is 21% of the overall cost of that medication. And Tier 4, the non-preferred drugs, is 50%. And then also your Tier 5 specialty drugs, you are paying 30% of that medication's overall cost. Looking below there again, we have the 90-day mail order supply. So again, it's where Medica is just mailing you your meds, or the pharmacy, I should say, that Medica is using is mailing you your meds as a 90-day supply. The Tier 1 preferred generics, $0. Tier 2 generics, $21 for a 90-day supply. Tier 3 preferred brand, 21% of the overall cost. And Tier 4 non-preferred drugs, again, 50% of the overall cost. Again, I just want to, say that the catastrophic coverage applies also to this plan. So if you are on lots of medications or some higher cost medications, you may max out mid-year and hit that catastrophic coverage phase. Others, might not see that during the year. And again, that H8889-009 plan is medical benefits only, so it does not include your prescription benefit, and you cannot add a standalone prescription plan to this particular Medica plan. I also want to touch on a couple other benefits that Medica does include. So they do include a free fitness membership. So they are going to utilize OnePass to administer your gym benefit. So if this is something you're interested in, you do have to contact OnePass. You can either call them or register online using your Medica ID and all your information from your Medica policy to activate your membership, and then OnePass will provide you with an ID number or a code that you will provide to any gyms or fitness facilities that accept OnePass. So you can use it at multiple different places. If your local gym accepts OnePass, you can use it there. And then if you are traveling, whether it's to another state or even just another city, and you want to use a gym in that new area, as long as they accept OnePass, you are able to do so. You can see they have a large network of over 25,000 gyms and fitness centers. So, hopefully you've got lots of options no matter where you are. They also have the personal health advocates and the telehealth coverage. So the virtual visits from home, you also have access to if you are someone who can't or doesn't like to get out as much as you may be used to. Again, on this page, it's going to talk about those dental and eyewear benefits. So we went over those amounts on the medical benefits page. But then on this page, it also does show kind of in that bottom right corner the OTC semi-annual amounts. What that is over the counter. So Medica is going to give you money also on that Visa card that you would use at the dental office and eyewear office. Um, they give you an extra bucket, if you will, of money to spend two different times during the year. So again, it's a semi-annual benefit. So if you are on the value plan or the $0 plan with prescription coverage, you get $45 twice a year. So January 1st, that card will automatically be loaded with $45 to spend by the end of June. And July 1st, it will be loaded with another $45 to spend before the end of December. This can be used to purchase any over-the-counter items, Band-Aids, vitamins. I think they've got things on there such as like bathroom scales, thermometers, lotions, toothbrushes, lots of different options. You can do so by going online and purchasing through the CVS, the Medica partnered CVS website, um, or you can go to select in-store retailers as well. The select plan, again, is going to work the same way, but you do only get $45, or excuse me, $40 with the select plan twice a year. The preferred plan, you are going to get $60 twice a year to spend, and that H8889-009 or the medical only plan gets $50 to spend twice a year. If you have questions about anything we went over today, please give our office a call at 258-6644. If you have mailed in a list of your prescription medications to our office, we are still working on running those. Someone from our team will reach out as soon as we have gotten through all of them to let you know how they look, with the plan that you are on for 2026. If you are on Medica and you are happy with your plan, you don't want any changes, the plan will automatically renew into the new year. You don't have to do anything. But if you are on one Medica plan, let's say you're on the zero value plan, and you would like to switch to the select or the preferred plan, just give us a call. We can also help with that as well. Other than that, I think that is all I have for you guys today. So thank you for joining. And like I said, give us a call if you have any questions.